This is the agenda for the afternoon. So you have me doing a little bit of the intro, housekeeping. We then have Estelle from NHS England, who's going to be taking you through the trust level free text workbooks. So if you're from an NHS trust, the free text workbook would be sent to you directly. If you don't think you've received that, then you can pop us an email, pop a message in the chat, and we can make sure that one of those gets out to you. We'll then take a short comfort break before moving on to looking at the trust level response rate data. These were reports that were also sent to you directly because they're HTML files. So Richard, Senior Analyst at NHS England, is going to take you through what information you can get from the trust level response rate data. And we will end the session looking at the online dashboard for CPES. So you may be aware that we refreshed the dashboarding for CPES 2022. So I'm going to take you through the kinds of information you can find on the dashboard, some of the key functionality and features of that. Our hard stop is 20 to 4, but we won't hang around if we finish before that. So don't worry, we won't just make up kind of questions to ask each other for the remaining few minutes if we finish early. But there are opportunities for Q&A throughout. So please do take the opportunity to kind of question us on anything that you may want to.
Okay. Yeah, like Jenny said, I'm Estelle, Qualitative Senior Analyst at NHS England, and I'm going to be talking through the free text workbook today. You can see at the bottom there's quite a few different sheets. So I'm just going to talk through each of those and give a few tips as I go along about how you could use them. Apologies, I will be looking over in this direction pretty much the whole time because I've got 3 screens, and the screens I need to look at are over to my right. Yeah, so I've got the sheet open. Not much to say about the first sheet, the cover sheet. It will have your trust name there, but I'm just going to dive straight into the next sheet, which is the guidance notes. So this kind of, the title says what it is. It's guidance notes about how to use the workbook, some of the caveats around the data, etc. Everything that's in here, most of it I'm going to cover as I talk through today, so I'm not intending to spend time going through this. The one thing I would say, though, if you're new to the workbook, definitely have a read of this sheet before you get going using it, because it will give you a lot of the context and tips around how to use it. The one thing that I do want to point out on this sheet is these 3 questions here. So the whole workbook is all about using the data that comes from these 3 free text questions in the survey. So overall, how do you describe your care and treatment? Is there anything that could have been improved, and any other comments? This sheet isn't about the quantitative data, it isn't about the answers, categorical answers. It's all about the text, written answers that people put in to the survey from these 3 questions. Moving on to the subtopic description sheet. Just say as well, I've zoomed in as far as I can on these sheets. So if you're not able to see them, I think there's a function on Teams where you can zoom in a bit more, but they're a bit bigger than you will see when you open up your workbooks that you get for your trust. So this sheet sort of starts to get into letting you understand a bit better what the workbook does. So each of the responses to the free text questions is assigned to topics, and this sheet is essentially a list of what those topics are with a brief explanation of what the topic's about. So you can see here I've got one, access to TV. So if someone had written in their comment, I would have liked to have TV on the board, that would be mapped to the access to TV subtopic. Again, before using the workbook, I'd suggest that you have a read through, familiarise yourself with the subtopics. It will mean the data, when you're looking at the other sheets, will make a lot more sense. And it's essentially a reference sheet, so you've always got that to go back to if you're not sure exactly what a topic is about. A little bit more context, which is covered on the guidance sheet, but the topics are assigned to the data using an automated approach, so they haven't been read by a human said, okay, this is the topic it relates to. It is a machine learning automated approach, and there's more detail, some of the caveats around that on the guidance sheet, but I just wanted to point that out up front. Responses as well can be mapped to multiple topics, so it isn't just like, okay, the comment is mostly talking about appointment letters, we're going to map it there and leave it there. It can be mapped to as many subtopics as necessary. Sometimes people put one sentence in, sometimes people put a whole paragraph, so it's quite important that as many subtopics are applied as the comments about. Moving on to the report sheet. So this is where you can actually start interacting with the data, and what you're presented with when you open this up is a series of charts, and then on the left hand side got a series of filters, so you can click on these to change exactly what it is you're seeing on the charts. So the first charts we've got here, total number of comments. We've got the number of comments per topic, and then underneath the number of comments per subtopic. The key message I really want to get across about this sheet is to think about it as a data exploration sheet, not advising using these volumes in reporting. So for example, I wouldn't expect people to be going to the trust board saying we've got 8 comments about facilities, we've got 18 about appointments. The whole data set's about actually needing to read the actual comments, but this sheet gives you a real good way into thinking about where you're going to start looking first. We often hear that the volume of qualitative data is a barrier to its use. So the workbook is all about organising your data into manageable chunks, which are the subtopics. And this kind of organisation is usually the starting point, even when you're doing manual qualitative work. So the idea is it saved you time by already sort of putting your data into these subtopics. But it really is all about going down, drilling down into the underlying comments. Just to say a bit more about how this sheet works, as I said, we've got filters on the left. So I'm just going to give a bit of an example of that. Say we wanted to look at the topic of facilities, just need to click on that. It'll change the chart so you're only seeing facilities. Then underneath you can see each of the subtopics that come under facilities and how many comments there are there. So let's say we're just interested in the comments about parking, and click on that, and if you scroll right to the bottom, it gives you the actual comments themselves. So you've got the volumes and then you've got the comments at the bottom. So you've got these filters here to drill down. If you want to remove the filters, you can just click where it says clear filter. The chart will go back to how it was. So you can see how you can change the charts to show what it is you're interested in. At the moment, I've got it on topics, but you'll see there's also this option of attributes. So if I just click on there, so what the attributes are is they're similar to the subtopics, but they provide a bit of context to the comments. So we've got attribute around treatments, one around who, so which type of person the comment's talking about, place of care and stage of care. So if I drill down into the who one, just give you a sense of what that's about. So if you've got comments talking about nurses, you might have comments talking about Macmillan staff, GP, etc. So we click on to choose GP. It's the same principle. You can drill down and you'll get the comments at the bottom that mention GPs. So as well as your subtopics, you have got these attributes which can provide a bit more context about the comment. I'm just going to put it back onto topics. Another thing that I wanted to point out about these sheets, and this is true across the trusts, is the subtopic general positive experience has the highest volume of comments, and that's really typical. And however, if we have a look at the kind of comments that fall under that, I'm just going to choose that subtopic from the filter. So if we scroll down, look at the comments, even though there's the highest volume, we can see that the data is really thin. So when we talk about thin data in qualitative work, it means there's not much detail. The comments are really short. So looking down, we can see most of them are saying things like excellent, very good, 10 out of 10. I just wanted to point that out, because if we're thinking about volume being a barrier, some of these large categories can actually be very quick to look over because the data is so thin. So in this example, analytically, there's nothing else that we can do with that really. So sometimes you can quickly sort of siphon off some of the larger topics. So here it's valuable, it's something positive to share within the trust, but in terms of a need for more analysis, there's not much you can do with that. And just thinking about the topics in that way can suddenly make the volume seem a lot less daunting, and you can actually spend more time on subtopics where there are less comments, but there's actually more detail in those comments. And I'll just show you an example of that. So if we get rid of the filters again, just going to choose communication and communication topic. So what I'd say about the sheet is you can use it to establish your chunkiest subtopics. When I say that, I don't just mean the volume, but also the length and the detail of the comments. So I've chosen communication here, and if you just think back to when we looked at the general positive comments, you can immediately see that these ones were a lot longer, they're a lot more detailed. So you can sort of use this sheet to help you prioritise where you're going to look first. If you've got more time, you could take a look at one of the subtopics with the longer comments. If you haven't got so much time, you can have a look at some of the smaller ones. But yeah, it can basically help you prioritise where to look first. The charts I haven't mentioned yet are these ones over on the right hand side, which basically break down how many comments are coming from which question in the survey. So you've got the overall, how would you describe your care and treatment comments. We had 8 answers coming from that one. Anything that could be improved got 10. Any other comments, 5. These charts I think are quite useful because they can indicate where you've got variation in what people are saying. They tend to be negative answers in the what could be improved, and a bit more of a mixture in the others. So that might spark your curiosity, thinking, is there a bit of variation in what people are saying in relation to this topic? Other messages, I'd say don't dismiss looking at low volume topics, particularly if you're surprised to see them coming up for your trust. We just take that off. You can see some topics have got very few comments, but that doesn't mean there's nothing of interest in there. So just something to bear in mind. So get to know your data a bit better, and then you can look at the subtopics in turn. So my overall message for this sheet is it gives you a quick overview, but the value is actually in the content of the comments, and it's on the other sheets where you can really start looking at the actual text data. So if we go into the data sheet, so here you've basically got all your data that was sitting behind those charts in a table. It's got some extra information in here that you don't get on the charts. So you can see it's got demographic data. So we've got age, ethnicity, gender, deprivation group. So you're starting to get a bit more information and different ways to look at the data. So you might have decided which subtopic you want to look at from looking at the report sheet. So then you can come in here and let's say you were interested in parking and put a filter on for that, and you might want to check the demographic data as well. So here it looks like it's people in the older age groups that are bringing up parking. Of more interest for subtopics than others, but that data's there for you to use. Also, another thing to think about in terms of tips, there might be value in dividing your data up to be distributed to the most relevant team. So one example I'd use here is facilities. That might be best shared with the Estates and Facilities Department. A lot of comments there tend to identify areas that they'd be in position to action. So, for example, you might be talking of, I've seen trends for that category about the signage could be improved in a particular building. So if that's been sent over to estates and facilities, they're most likely to be able to action that, rather than, say, being of less value to nursing staff. So again, you could have a think about who's best to receive the data. You can filter by the topics. So in this case, we were just looking at facilities. You could just copy that into another sheet, send that over to the right people, which means that everyone isn't having to look at everything. Again, that could be another good way to divide things up so the volume's not so overwhelming. That's the data sheet. We go into the data summary sheet. So as a qualitative analyst, it's probably my favourite sheet because it gives you the most information and different ways to cut your data. So one bit of information we've got in here that isn't in the other sheets is the count of topics. So if you remember, I said a comment could be mapped to quite a few different topics. Here it will give you the number of how many it's been mapped to, and also the actual topics that is. Unsurprisingly, if you scroll down, you can see that the longer comments tend to have a lot more topics mapped to them than the shorter ones. So this one's very long. It's got 8 different topics, whereas these shorter ones, we just got 1 topic assigned to those. So that's pretty typical. Again, you've got the demographic data in here. And the other benefit of this sheet is you've got a column for every single attribute and subtopic. So you can do some different filtering options. So for example, you could be interested in staff training, so you could filter just for the yeses on the training subtopic, but you're interested in that just for GPs, so you could put a filter on the GPs, and then you could see all the comments that were related to both of those things. So that's the advantage of this sheet. So the last sheet we've got in here is an action log. So you should be using your report, your data summary sheets to look at the comments, start to develop findings. But this is the action log, is a place where you can actually start recording what your findings are. So if we just jump back to the report sheet, I'm just going to sort of talk through a very simple example of how I developed a finding from the data. So in this example, I was interested in communication, so I'm going to filter for that. And I was particularly interested in appointment letters. Again, I've got the subtopic, click on that. There we go. So I was immediately curious that it's coming from the different questions. So that, again, that sparks a bit of interest. Is there variation in what people are saying? So what I'm going to do, I've got all the comments at the bottom. Actually, I've decided I just want to look at the comments that are coming from the, was there anything that could have been improved question? So if I scroll back to the top and just choose that filter, then I've just got the 3 comments from that question. And what I've done, when I've read through those comments, I could see that people were saying that they'd received appointment letters too late, and that was creating problems for them being able to attend appointments. And where people were saying that, they were also bringing that up alongside mentions of a lack of staff. So I'm starting to notice a pattern there. If I go back up, I actually want to look for all the questions, not just anything that could have been improved. So I will clear that filter, go back down, and I read through the rest of the comments as well. I can see actually things are going fine for other people. They're saying they are receiving their appointment letters in a timely way, but the key seems to be where it's not working is because of staff shortages. So what I'm going to do, jump back to the action log, start to fill that out. So action 1, it was appointment letters was a subtopic I was looking at, and I'm going to put my finding in there. So I just put appointment letters arriving late, leading to missed, unable to attend appointments. Where this is happening, patients are attributing this to staff shortages. So that's a really basic example of how you could start to draw findings. There's lots of different columns in the action log, so you can, take your finding wherever it needs to go within your trust, discuss it, decide what action steps you might want to take, and you can fill this in. You might want to put a deadline around something, say what priority it is, etc. So that's there for you to use however best in your trust. Let's say as well, it's not necessary just for sort of areas that need improvement. You might actually find a positive finding in your data, and you could record that in here as well. And the action might just be actually sharing that with people, saying things going well here. This is what seems to sit behind that, and to promote people acting in that way. So just worth remembering, it's not just areas for improvement. So hopefully you can see how you could start to use this to build up your findings, thinking about what you need to do in relation to what the comments are telling you. I didn't do it for this example, but I could have gone to the data summary sheet as well and looked in a bit more of a granular way. So I could have filtered for the appointment letters in here and just had a look, is this coming up for particular demographic groups? I only had 6 comments there, but you might have a subtopic where you've got a lot more comments, and it can be particularly useful to go and break things down further in that sheet where that's the case. So just to give you a bit of flavour of other sort of things that I saw, so I was having a little look at the comments in this workbook, using the sheets. So I was able to look at staff training subtopic, and I could see that was particularly focused on Macmillan staff. So where people were bringing up training, that tends to be about Macmillan. And I was able to drill down to that by using the WHO attribute for Macmillan. I also looked at cleanliness, and I could see that was particularly coming up in relation to bathrooms and toilets. So that's kind of sort of examples of patterns that you could start to see in the data, depending on what people are saying. Another tip that I just wanted to highlight here was, don't fall into the trap of thinking there's only a small number of comments for a subtopic, so there's not an issue. Using the cleanliness example I just said, it could be that it was only 2 people bringing up the issue of bathrooms and toilets being clean, but it's unlikely that it's only an issue for those 2 people mentioning it. It's likely to be an issue for anyone using those bathrooms and toilets. So it's not the case that a small number of comments mean it's not an issue. So just something to bear in mind. So in that cleanliness example, some of the kinds of actions you might want to think of, the action log could be things like the data's indicating it'd be worth going to have a look at the frequency of cleaning, how often the bathrooms, toilets being checked, etc. So hopefully you can start to see the connections between looking at the comments and devising actions coming from those. So that's a really quick tour of the workbook. I've kind of drifted in talking about best ways to use qualitative data, as it is all about the quality of data in the workbooks. So if you feel like you need more training, more information on that, I'm going to put a link in the chat now. So we do have a training module on making best use of qualitative data, and it very much sort of echoes some of what I've said today. So I'm just going to put that in the chat. But happy to answer any questions anyone's got on that. There might have been some coming through while I was talking.
Thanks for sharing that link, Estelle, and that was all really, really clear. Thank you. Mainly in the chat, we've just had requests from people wanting to see a copy of their workbook. So my colleague Caroline has just popped a note in to say if people can email CPES, because we may not have you down on our contacts list if you're not a main or reserve contact for your trust. So we just need to make sure we have your contact details so we can sort that out. We also have a comment from Lisa, who's at an alliance, who, because they're an alliance, they don't receive a copy of the free text workbooks of the trust within their area. At the moment, that's down to the kind of information governance and us wanting to make sure that the trusts are the ones that providing permission to share rather than us, but it is something that we've had noted down as feedback before. So I know that you and kind of other NHS England colleagues have it on there as list as something to continue to look at, investigate with information governance in the future as well. I'll just open the floor to see if there's any kind of questions or queries people want to raise their hand on and ask Estelle. Yes, Lee, would you like to bring yourself off mute?
Hello, hi. Thank you so much. That was really helpful, and I've been using the dashboard actually quite a lot to build reports for Kingston Hospital, and it's amazing, and it doesn't exist for any of the other surveys, so it's really, really helpful. One of the things I found when I was looking through it, and I'm really sorry because people have been asking me questions about other things, so I may have missed it when you said it, but one of the things that I found challenging was or that I withdrew the data from it and did myself, was whether the comment was a positive comment or a negative comment where once it had been tracked into its individual box. So for example, you used the example of cleanliness. Some patients might say, I was amazingly impressed because it was so clean, and that would be tracked to the cleanliness pile, but so would the toilets were never clean. And so I had to kind of manually do that bit to say 25 patients commented on cleanliness and 5 was negative and 2 were positive. I wondered if that was something we could build into the future, or if it's something that I just didn't work out how to use the system well enough myself. But on the whole, it was amazing, and thank you very much.
Yeah, it's not currently in there. I suppose the nearest thing to it is what I was saying about these charts, saying the spread of where the answers are coming from. So usually you'd find negative responses to the question 2. Is there anything that could have been improved? That's not always the case, because people do like to put answers in any of the boxes. Sometimes they don't neatly follow the survey.
Other people found this about their comments, but maybe it's unique to this group of patients, but they very often, if they said something negative, they wanted to say something positive at the same time. So when answering that second question, that second open-ended question, they'd often say the toilets were never clean, but the staff were always amazing, because they wanted to convey that in their messaging, I guess. So that it didn't quite tally with that, but yes, I understand. Thank you.
So anything more you want to say on that, Jenny? Because I know something we've looked at.
No, I think just briefly, yes, it is something that we've looked at. And when we so Estelle mentioned the kind of machine learning model that we have, and when it's analysing comments that are received to a question that's kind of towards the negative, if you like the question 2, it doesn't handle very well being able to distinguish kind of positive and negative from a set that can be mainly negative. So it struggles with that. But we'll note it down as something to look at in the future, because actually for 2023 survey, the free text questions have changed slightly. So it may be something that we want to evaluate again when we're looking at the data that comes back from the survey that's in fieldwork at the moment.
Yeah, I would tackle it the same. It sounds like how you've done as well, like take the data and have to read through the comments and do that.
Yeah, I mean, like I said, it was brilliant to work with, really easy. Thank you. Yes, thank you very much. Thank you.
Thanks, Lee. Any other questions or comments anyone would like to give? Yes, Sarah, would you like to come off mute?
Hiya, thanks. I've just been having a look at it the last sort of couple of days, so I haven't had much chance to really go over it. But I'm just wondering, is it all sort of machine led? There's nobody sort of looking at it in the background? Just because some of the questions for us, when a patient's gone to give feedback, that would obviously really help us to make some improvements. There's a lot of question marks, so I'm assuming it's a handwriting thing. The machine hasn't been able to pull up the handwriting. And when I'm reading through the comment, I can't really get the gist of what it is they're trying to say, because it is very much all question marks in the comments, and I'm seeing it quite a lot for our trust. And I'm just wondering if that's what other people are finding, or if it, and just for going forward, is this something that people would be able to look at in the background? You know, if the machine's not able to pull the comments forward, would a person be able to look over it? Because obviously the comments, we're not getting much from that if we can't actually understand what it's trying to say.
That does sound a bit odd. The process essentially is that we don't do a lot of cleaning of free text comments at all. So the text that would text that goes in is what comes out, if you like. So we don't do any cleansing of like names, swear words, that type of thing. So it sounds like a bit of an odd situation, and I really don't think it's to do with lots of your patients kind of putting multiple question marks anywhere. So we'll probably want to look at that for you and just double check to see what we to see if there's anything that's a bit peculiar going on for you. Which trust are you from, Sarah?
Newcastle Hospitals.
Okay.
Is it worth us pulling a few together to sort of send them on? Because, like I said, I've only looked at it the last couple of days, but just some of the categories I've looked at when I'm reading through the comments and just see it'll maybe start saying something and then there's a big block of question marks and I'm thinking, well, I can't work out what they're trying to say.
Yeah. We'll take a look at that. No need to send us any of the comments because we'll kind of dig around in your workbook and of course the data that we know goes into it, and take a look at that. What you tend to find is because the surveys run online and paper, we obviously have online people are typing in the comments, so it's a lot easier for auto correct, that type of thing. And so handwriting may be an issue on the paper ones, but it doesn't sound like it would be to the extent that you're talking to.
Thank you very much.
No problem. Any other questions or queries for Estelle? No. Okay. Thank you so much, Estelle, for that session. That was really helpful. Okay, so welcome back, everybody. So the next session we have in this webinar is going to be led by Richard, who'll be taking us through the response rate outputs that we provide to trusts. These outputs are sent to our main contacts and reserve contacts we have down for each trust for the survey. The aim of the outputs is to really help you understand who's included in your CPES sample, but also who's responded to the survey as well from your trust. So I'll hand over to Richard, who's going to be taking us through one of those outputs.
Excellent. Am I off mute, first of all?
Yes, you are.
That is a good start. Thanks, Jenny. So, in fact, I'll share my screen before I say a word, just to make sure it's actually working correctly. You should see the CPES website for now.
Yep, I can.
Lovely. Thanks, Jenny. So good afternoon. There's possibly a few people on the call who know me, but I think most people probably won't. So my name's Richard. I work for NHS England, essentially supporting CPES from a quant perspective. So just anything on the numbers side, supporting the insight and feedback team and Picker. And I want to talk through some of what we've done over response rates, because this is off the back of the overall response rate for CPES relative to other surveys is actually still quite high, but has been dropping over the last few years now. And also there's a fair amount of variation between different minority groups. So last year we put out some national and trust reports for the first time, going through response rates, and we've, as Jenny just said, updated and sent out those for the second time this year as an update. So I wanted to go through what there is, where you can find it, and then just a little bit on how to use it and what you can get from it, and just a few of the main messages that are in both the national and what you can get out of your individual trust reports. So it won't be completely comprehensive, but hopefully it'll give you a flavour of essentially what you can go away and look at. So to begin with, the national version of the response rates report is available on the CPES website. So I'll just be completely clear and point out that you can get it on the results page. And if you go to the latest results and go to the national section, and then if you scroll down to the bottom, you'll find the national response rate breakdowns there. And if you click that, you'll get an HTML download. As Jenny says, each survey lead in each of the trusts has been sent a trust version of this report, which is, to all intents and purposes, identical to the national one. So you'll be able to use that as a comparator, essentially. So I will start off by going through what's in the document with the national version first of all. So there's an introduction which tells you a lot of things about the survey which you might already know, things like who's actually eligible to participate, and clarifying the details of what exactly we're talking about when we talk about response rates. So essentially, how many people did answer divided by the number of people who could answer, and then that's expressed as a percentage. In fact, I should mention also that those who couldn't answer, either because they'd passed away before field work or change of address, things like that, where the survey couldn't get to them, they're not included in this. We're focusing on people who actually could answer but didn't. So the first section shows the response rates overall and split by different subgroups. And then there is also a section at the bottom, which I probably won't get a chance to talk through, which just explains who's actually in the survey. So what proportion each subgroup makes up to the actual response. That's who's in the survey as opposed to the percentage who are responding. So I'll just go through a few bits and bobs of the charts and tables to explain how it works. So the point of this being an HTML rather than just a slide deck is it's a little bit more interactive and a bit more flexible than a static output would be. So for each group, there is a chart where you can hover over any of the bars to find out a little bit more information. So here I've got the overall response rates year on year, and if I hover over any of these bars, it will just give me a little bit more about each one. So for here, we've got the 2019 response rate, which was 60.9%. And that is out of the overall sample size that was 111,366. So on any of the charts on there, you can hover over any of the bars to get a little bit more of the information out of there. All of the charts on here will have 3 years worth of data, primarily because to put more than 3 years on makes things a little bit messy. You might notice the gap for 2020, which was the voluntary participation year when not all trusts were in due to COVID. So that's why there's only we've got 3 years, but one of them isn't 2020. You'll also see a set of tools on each chart. So as you hover over any of these, you'll see a list of little icons here. So the main things you might want to use are, there's a little option there to download the plot as a PNG file. So if you click that, it will download it into your web downloads, and you can take that and use that elsewhere if you want to do. And if I scroll down onto one of the slightly more detailed ones, there is also the box select is probably the most useful one for zooming, because if for whatever reason you want to look at a section of it in more detail. In fact, I think I might have picked the wrong thing. Well, in theory that should have worked, but I've always picked a zoom option that isn't functioning, I'm afraid. So on each one, I'll click onto the table option, which is definitely functioning. That will give you the full details for each year and for each subgroup. And that will give the number of people who responded, the sample size for each subgroup, what the response rate is. And then each of them will have what's listed here as difference to overall rate, which will be sorted in descending order there. So essentially, the group at the top will be where there's the biggest gap between that group and the national rate. So here, from a national perspective, you can see that the 16 to 24-year-old response rate is a shade below 20%, which is 33% below the overall national one. And from each of the tables, you can use these Excel and CSV buttons to spit the table out into an Excel format to use elsewhere if you want to do that. I'll mention cancer types because that's the only thing on here that doesn't have an actual chart attached, and that's just because there are 38 cancer types, which is too many to squeeze onto a specific chart. But there is a search box in here, so if there's a lot of categories on there and there's something in particular that you're wanting to look at, I will start searching for leukemia on this, and that will then, if there's something in particular that you're interested in just looking at that one, then that will bring up the search term that you've used and just put that into the table and filter just the thing that you're interested in looking at. So in terms of main messages that we might look at, I will just scroll back up to the top just to dwell on the overall response rate for a moment. So as I said before, fairly high in the world of surveys, but in terms of the trend, you can see it's gone from about 61% in 2019 to this year's response rate that is 53. So we are on a downward trend from an overall perspective. I will just go back into the age group, although unfortunately that has just... So you see on the age group one, there is a similar downward trend across the board on here. But I'll just refresh this page, sorry. So across each age group, you can see that the downward trend is replicated, but starting from a very different position across each of the age groups. So you'll see very obviously 16 to 24 as an age group, as I touched on before, is quite a low percentage compared to some of the others. So we have about a 20% response rate for the 16 to 24. And you'll see it becomes about 3 times as big when you go into, say, 65 to 74, 75 to 84, and 85 plus. You're in the realms of roughly a 60% response rate. So we do have quite a big discrepancy from an age group perspective. And then if I perhaps just pick up deprivation, roughly tracks what you might expect to see from a most deprived up to the least deprived, but that's not quite as big a discrepancy as you would see for age group or for ethnicity. So I will just zoom in on a little bit of this chart just to focus on some of the differences in ethnicity. So I can just zoom in onto this section of the chart. So these are the response rates for the white British subgroup, where for this year, that response rate is 55.3, which is roughly the same as the overall one. And in some of the subgroups on here, that is quite a lot smaller. So the ones that stand out in particular on here are some of the Asian subgroups. So again, if I zoom in on the section of subgroups that are Asian, you'll see that for Asian Bangladeshi and Asian Pakistani, you've got response rates down in the 20s, so about 25 and 21 there. So there are some pretty big discrepancies, and this is from a national perspective, of course, not for a specific trust. And what I'm doing here is just homing in on some of the bigger differences, but it's not necessarily the things that you might be most interested in. These are just some examples of what you might want to look at. So I will just move across then to an example trust one, just to kind of show possibilities from a comparing point of view. So this is the response rate for no such NHS Foundation trust. So if you were to go into something like the age group response rates for your trust, I mean, these are relatively invented numbers in this one, but you would see that, for instance, the 16 to 24 group is also the lowest, albeit in this case very low. So you would then be able to click between your own trust and the national one and just see how those sort of things compare. And for this trust, what you might notice the difference for is that for the 85 plus group, this has a response rate of 35 compared to the national one where the response rate is 53. So it's just being able to look at your own trust results and compare to the national and see, is this a specific issue for us as a trust, or is it something that's replicated from a national perspective? So to look at another example, let's say Tumor Group. So for this trust, you might be able to see that the particularly low response rates for this year would be brain and central nervous system and sarcoma. And if you were to look into the national version, you will see that the lower response rate is replicated for brain and central nervous system, which is 32, but sarcoma has a response rate of 48 from a national perspective. So that is one where you would see quite a discrepancy between that and the response rate of 29 for this example trust. So I don't know how I'm doing for time. Jenny, is this a good time to open up to questions?
Yes, you've got about 7 minutes left, so we can stop there if you like, unless there's anything else you wanted to go through, Richard.
I'll open up to questions. I think I've gone through roughly as much as I wanted to go through.
Okay, perfect. We just had a question in the chat about how the response rate is calculated. I've responded to that one, just saying that it's number of people sent the survey minus people that are recorded as deceased or ineligible, or where we've got a questionnaire that's undelivered. So that's all we had in the chat. Has anyone got any questions that they'd like to ask Richard at all? Then please pop your hand up. Yes, Hannah, do you want to go ahead?
Sorry, how did you compare trust results to the national? Were you merging them somehow?
Sorry, I was just clicking between. I'll just I'll reshare my screen. Sorry, just what I probably could have done is put them side by side. So if I just bring that one out. I'm now doing a very bad job of lining things up. So in this case, on the right-hand side, I've got the trust one. So for instance, there, hopefully you can just about see the sarcoma response rates there. And then on the left-hand side, I've got the national ones.
Oh, okay, you have to open them separately. That's fine. I thought you'd somehow done something clever.
No, I hadn't done any sort of merging, and
Hmm.
probably in an ideal world, what we would have is the national results shown in the same one as the trust. But the problem then becomes that once you've got, say, 12 different tumour groups and 3 different years replicated for the national and the trust, it just becomes really, really messy. So we've had to sort of take a decision about what we separate out. So no, I haven't done anything clever. It's just really whatever's most straightforward. Probably ideally, you would want to spit the charts out separately and then maybe sit them side by side on a slide. Might be something to consider if there were 2 things that you were particularly interested in.
Thank you.
Thanks, Hannah. Angus, do you want to come in?
Yeah, hi. I'm not seeing, for our trust, I don't see that bar chart in the same way. What I'm
Okay.
seeing is like a list of tumour sites and numbers of respondents for, if we're looking at, say, ethnicity.
Yep.
So I'm not sure where to find that.
That's interesting. So look at the ethnicity one. Are you just seeing a table like that?
No, it's in the PDF, so I don't know if I'm getting it in the same way then. Is that through an active table then? Because this is through the PDF.
I think you're talking about the PDF quant report that we send Richard, rather than this HTML document. So it may be. I don't think you're looking in the right output.
So maybe I'm not. Maybe I don't have access to that yet. Then
are you the main contact for your trust, Angus?
Yeah. My name's Morven.
Oh, sorry.
My surname.
Apologies.
That's all right. That's okay. The main contact, somebody from patient experience, so I can liaise with them.
Yeah, if you pop them an email, they will have received it to their inbox. They'll be able to share it with you.
Thank you.
So our last section for this afternoon is going to be looking through the dashboards that we have for the Cancer Patient Experience Survey. So I will navigate you firstly on how to get to the dashboards, and then some of the features that you'll see in the dashboard as well. So I'll just open up my browser. Richard, would you mind confirming that you can see the CPES website on my screen?
I can indeed, yes.
Perfect, thank you so much. So I'll just navigate you from the CPES website to the dashboarding website. So this is the home page for CPES. And to get to the interactive dashboard, you want to go to results in the main menu and click on interactive results. And then once you scroll down, you'll see this big blue button that will take you to the interactive dashboard. So when you arrive at the dashboard, you'll be taken to the how-to page, which is basically a bit of a manual of what lives on the dashboard, the types of things you'll see, and some of the features that we have as well. Before I just go into a little bit more detail about this page, I want to talk about the navigation menu on the left-hand side. So most of the navigation around the dashboard happens in this left-hand menu. So the left-hand menu, once you click on these little white buttons, it will take you to the page that you're after. Some of these buttons will have a sub-menu to them as well. So they'll expand depending on whether you want to look at trend or subgroup results, or whether you're interested in looking between comparisons between organisations. So this sub-menu will expand for the Cancer Alliance, Integrated Care Board and NHS Trust levels, and the national page just has the one page. Hopefully you're familiar with these reporting levels as the ones that feature kind of throughout the quantitative reporting we provide for CPES. So we've kind of spoken a bit about the PDF reports that you'll find on the website and some of the Excels you can download. So if you look in those, you'll see that there are versions for Cancer Alliance, Integrated Care Board, NHS Trust, and a national level as well. Just finally on this side menu, there's a hide button here. That really is just to give you a bit more space to look at stuff on your screen. So if you've got a tiny laptop or you're looking on your iPad, for example, it can be quite useful to hide that menu item. So just on the how-to page, so as I mentioned, this is a bit of a manual for what to do on the dashboard and what you can see. So this page starts off with explaining some of the features that are included on each page and with each dashboard. And I'll go through these in a little bit more detail when we go and have a look at the national results. But in most cases, you'll see charts and tables on each page. You'll be able to search through those charts and tables, and you'll be able to download data from the view that you're looking at. So that's some of the features that I'll take you through. The rest of the information on this page just goes into detail about each of those pages. So you can see that there's an accordion menu here, that will give you information about each of the reporting pages we have on the site. So for example, I can open up this one and it will tell me what I'll find if I go and have a look at the national page, or indeed what I'll find if I go look at an NHS Trust comparisons between organisation page. So this is the place to go if you're not sure where you really want to look. You've got a research question, but you don't know which view will help you answer it. This is the page to look at and help you navigate where you need to go to. The last section on this page is just an understanding the survey results information. It gives you a bit more information about some of the techniques we use with the data. So for example, how we score questions, the difference between adjusted and unadjusted scores. We show confidence intervals on the online reporting, so it tells you a bit about that. And it tells you a bit about how we compare organisations against each other, and also we do a bit of data suppression for confidentiality reasons, so it will give you some information about that as well. So all of these are clickable and will expand and take you through to the relevant information. You'll find throughout this page there are links to the survey instructions page on the NCPES website. And that's because we have a technical document that lives on that page, which just gives you further information about the techniques we use on the data for the survey. So if you're really interested in the ins and outs, then I'd suggest you go and have a look at that technical document, which is quite handy. So that's just the how to use the dashboard. So let's get into the real nitty gritty of it. So I've just selected to have a look at the national page that we have on the dashboard. And the first thing I want to talk about is the set of filters that we have at the top of the page. So we have 5 filters here that are immediately visible. And this just allows you to narrow down what you want to look at. So when you arrive on this screen, it's automatically selected question 2 for you. But you can use these filters to select the question you'd like to see, to select the year of data you'd like to look at, and then to start to break that data down into subgroups as well. So for example, this first filter is questionnaire section. So what you might want to do is select a specific section from this item. So I've selected support from your GP practice. Essentially what this does is narrows down this question list for you. So instead of seeing a long list of 40 odd questions, you'd get the questions that are associated to that questionnaire section. and it just helps you find information a bit easier. Each of these filters has this bar at the top, and so that's a bar that you can type into. So instead of kind of clicking around, you can either start to write in there, and it will again reduce the list that you're seeing based on the word that you're typing in the box. So that's quite a useful feature as well. So that's the questionnaire section filter. I've mentioned the question filter. This is the big long list of every question that you'll find in CPES. So you can either, as I say, scroll all the way through, or you can start typing your question number in here and it will shorten down the list for you. We have a year filter. So at the moment, we have 2 years of data on the dashboard. We have data for 2021, 2022. Once we get through CPES 23, which is in Fieldwork at the moment, then we'll add 2023 to here as well. So at the moment, we've just selected to look at 1 year of data. But for example, I can choose to select 2 years of data instead, and it will bring up 2 years in the chart for me, as you can see here, 2021 versus 2022. What you'll see is this chart is dynamic. So when you've got 1 year of data, it will show you a bar. And when you select 2 years, it will change itself to a line graph. And that's just for ease of interpretation, especially once you get to adding subgroups as well. The next filters on this page are all about subgroup breakdowns. So these are the breakdowns you'll want to select if you want to look at results by things like age, by cancer outcome, if you want to look at results by ethnicity, long-term condition, sexual orientation, tumour group, cancer type, that kind of thing. So we've got a range of subgroup filters there for you. So when you initially select that first breakdown, what you'll see is the chart adapts and starts to show you all of the tumour groups at a national level and the results for those. You can see it gets pretty colourful when you've got lots of bars on the chart, but this is it showing by tumour group. What you may want to decide is actually you're interested in tumour group, but you're specifically interested in a specific tumour type itself. And so this next filter allows you to focus, for example, on breast cancer if you wanted to. So the chart's adapted itself, so we can just see breast cancer result for question 2 for year 2022. You might also want to see brain cancer alongside that. So it allows you to pick and choose the tumour groups that you want to focus on. At a national level, and this is only this is a feature that's only available at a national level currently, is the ability to add a second breakdown. So what you might want to do, and I'll just change this just for ease of looking at the chart. So I've just selected age there, and I'm looking at each of the age groups we have in the survey. You might want to choose a second breakdown. So I might want to actually see age by ethnicity, for example. And the chart adapts itself. So what I start to see is ethnicity, the ethnic group. So we have white, then we have mixed, and I can scroll along and it will take me all the way through to other and not given. And each of these bars represents an age group. So it's a great way of breaking the data down a little bit more. So for example, this is 16 to 24s in the white age group, and then we've got 25 to 34 in the white age group. So it just gives you a little bit more granularity in which to view data, which I think is particularly useful. This is available at the national level currently. We're exploring adding it for further levels, but we've got considerations around kind of suppression once we get into kind of the 2-level breakdowns. So it's just something we're exploring for the future. So I'm just going to turn my breakdowns off before I explore the next bit. When you look at your charts, if you're familiar with the CPES results, you'll know that we use scoring. And we tend to show positive scores when you're looking at reporting and when you're comparing kind of trust by trust, that type of thing. So the chart, when it immediately shows, is set on scores. So this is the score for question 2, 77.6%. The patient only spoke to the primary care professional once or twice before cancer diagnosis. What you might want to do actually is look at that question in a bit more detail. So I've selected frequency there, and what this does is it adapts the chart. So actually I'm seeing each response option for that question. So I'm not just seeing the positive score. I'm able to see how many people spoke to the healthcare professional once, twice, 3 times, etc. And I think that's really nice to be able to see, because sometimes you really want to see the breakdowns of how people have answered the question. The only other thing I want to mention with the chart is this little hamburger menu we have on the right hand side. So like Richard showed the functionality in the response rate reports, we have similar for the dashboard as well. This gives you options to print the charts, download the charts in various formats. So if you want to take an image of the chart, pop it in a PowerPoint presentation, that type of thing, this is the place to do that. You can download the data as CSV as well. So this is really great where you're wanting to share your results with other people, for example. Below the chart, you'll see that we have a table, and the table adapts itself to whatever you're viewing in the chart. So it will always match the chart. It's just a different way of showing you that information. So when you look at the table, what you'll see is that you'll see the score that's present in the chart, the 77.6, and you'll see the number of responses as well in there. I'll just expand the table just to give you a bit more information in there to look at. So I've just chosen age as my filter, and the table expands itself so you can see a row for each age group. The table has these grey buttons on the left, so you can also, as with the chart, download the information that's being viewed in the table. And it also has a search function. So if I wanted to narrow down the data that I was looking at, I can type in 16 and it will take me to the 16 and 24 group, and the chart adapts itself to that as well. So that's just quite a nice little function to have on the table. We also have sorting arrows. So if you wanted to sort the table by columns, that's possible too. So currently it's in age order, but I might want to change that so it's actually 85 plus down rather than 16 to 24 to 85. So you've just got these sort arrows, which are quite useful to have in the table as well. So that's the national page. So here you'll see the national results. You can break things down by year, and you can also look at the information by 2 breakdowns. So you could choose to look at information by age and ethnicity, tumour group by ethnicity, that type of thing. So it's really useful to be able to do that at a national level. What I'm going to do now is just show you the NHS Trust views. And what I'll take you through here, the functionality that you'll see in the Trust view is very similar to Cancer Alliance and ICB. So I don't want to go through those 2 as well, because I'd be repeating a lot of the information that I'm going to talk about. So I've just chosen to focus on NHS Trust. So as I mentioned, we have 2 sub-pages for NHS Trust. We have trend and subgroup results. So this is where you want to see a score for your trust for 2021 and 2022, or you might want to see some subgroup breakdowns. But if you wanted to compare your scores with other organisations, you'd click through to comparisons between organisations. But I'm going to start on this trend and subgroup results first. So the filters look very similar, but you'll see an additional one at the top. So this is the organisation filter. So this contains every NHS Trust who took part in CPES. So when I scroll through, I can go and pick a trust, and the page will adapt itself and show the results for that trust. On this page, you can just select one trust at a time to look at subgroup results and trend data. So I've just randomly picked Royal Devon, so I'll stick with that one for now. We have questionnaire section. That's exactly the same as the national view. This is just to allow you to shorten that question list down on the second filter, making it a bit easier for you. We have the question filter, so I'll just select question 38 just to change things up. And we have the year filter as well. So because I've selected Royal Devon, everything I'm doing from selecting Royal Devon is showing me the results for Royal Devon. So in this case, I'm looking at results for Royal Devon, question 38, and it will show me this line chart here for you. Again, we have a table at the bottom of the screen, which mimics what you'll see in the chart as well. And at trust level, ICB and Cancer Alliance, we just have the ability for one subgroup breakdown at the moment. So I'll just scroll down and see if I can find cancer type. Because I've got 2 years selected, when I click cancer type, it's going to get very busy. I'll just see if this shows. It might. There we go. It starts to get very busy indeed, and that's because of the number of cancer types that we have available to us. So sometimes it's easier to look at 1 year of breakdown at once. So for example, I've just selected age here. Very busy because of all the lines that you show, but you can hover over and it will highlight the line that you want to look at. You can also use this legend down here to pick a particular group that you want to look at as well, which is quite useful. So I'm seeing results for Royal Devon question 38 by age, and I'm able to look at differences between 2021 and 2022. And if I scroll down to the table, this will replicate what you're seeing in the chart. Where you see a dash, this is because we've added the suppression to the results. And this is where not enough people have replied in order, have given an answer in order for us to present the results for that group. So in this case, we've suppressed 16 to 24 and 25 to 34 age groups in that table. The same functionality here as the national, so you can choose to copy you copy the table or download into a CSV in Excel, and up here with the chart as well, where you can download the chart in different formats. I'll just select on 1 year of data just so I can show you the frequencies as well. So as the national, we land on a score view, but you can change it to a frequency view. So I'm able to see each response option for this question 38 as well. So that's the functionality of the trend and subgroup results page. I'm going to move on to the comparisons between organisations, which is a little bit of a different view. This is all about looking at kind of comparisons between organisations. When you land on this page, the chart sets itself to show every organisation that participated in the survey. So this is a very wide chart that you have to scroll through to see every result. So this is each trust result on question 2 in the survey. So it's a lot of scrolling involved. You don't have to remain on the 133 organisations. You can choose a number of organisations to focus on. So for example, I'm going to select Ashford. I might also want to have a look at Royal Surrey. And I will see if I can add Christie as well to that. So I've selected 3 organisations to look at for this question. And so you can see the chart then shows the 3 organisations in alphabetical order. But you also see the different colours that we present the bars on. And the colours relate to expected range, and that's how we do comparisons on CPES. If you want to know more about expected range, then go and have a look at the technical documents or the how to use dashboard, and it will go into that a little bit more. But just quickly on the colour coding. So the dark blue and light blue relates to organisations performing above or below what's expected of most organisations. So dark blue is better than expected and light blue is worse than expected, and kind of grey is in line with what's expected really. So you've got that colour coding on there. You've also got the black lines, which are the confidence intervals. So the how-to page gives you a little bit more information on confidence intervals, but they're quite useful to have when you're looking at comparisons and seeing if there's kind of real differences between the scores of each organisation. And the table again mirrors the chart. So I've got the 3 trusts that I selected, and the table will give you information on the scores, the number of responses. It gives you the performance rating as well. So we obviously have the dark blue, light blue and grey, but this table just gives you a bit more information related to that. So for example, Royal Blue, which is the dark blue, Royal Surrey, sorry, which is the dark blue bar, it tells you that the score is above upper expected range. And it gives you information about the confidence intervals as well. So the tables are actually a really nice resource when you get to comparing organisations, to give you kind of the level of info you need to be able to understand the comparisons that you're looking at. The table again has the sort functionality, which is very useful, and it has the search bar as well. So if I just decide I want to start to look at Ashford, it will do that for me in Adapt. That's pretty much the nuts and bolts of what's available on the dashboard as it is. We have a super boring cookies and privacy page if you wanted to go and have a look at that. What we do is we like to analyze the usefulness of the dashboard. So we have Google Analytics set up to help us understand who is viewing the dashboard and what page people are looking at the most. And that just helps us make improvements to the dashboard moving forward. So that's a bit of a whistle-stop tour. So I'm going to stop sharing my screen and see if there are any questions. Any questions or queries from anyone in the chat? No, I don't know if that was because I think I was incredibly clear or incredibly boring. It could be one of the two. I'm not sure. So if we don't have any queries on the dashboard, I'd like to just say thank you firstly to Estelle for taking us through the free text workbooks. They're a brilliant addition to CPES and helping people work through that data. They're really useful. Thank you for Richard for the response rate output demonstration. I think it's really useful to know who's included in the CPES sample and who we're hearing from, so that if Trust did want to do work on looking at representation, they can use that as some information to feed into. And finally, we hope the dashboard is a really useful improvement for the survey. I think it's easy to use, and I think it's the functionality that we've been able to build in is really useful. But for all of those three outputs and the rest of the information we provide for CPES, we're really keen on making sure we're improving year on year. So if you do have kind of suggestions for improvements, then we're always willing to listen and learn, and I know some of that has been kind of included in the chat window already around kind of free text workbooks and the ability for Cancer Alliances to see data and that type of thing. So if there's no more kind of questions or queries, then we'll end the session there. Thank you so much everyone for coming along and hearing our demonstration of the outputs.